I think we can conclude on a very optimistic note. We are making major advances in managing atrial fibrillation. We have a much better understanding of the genetics of atrial fibrillation, of the risks of stroke from atrial fibrillation with the more sophisticated CHADS-VASc score rather than simply the CHADS-2 score, a better sense of vulnerability to major bleeding from anticoagulation of atrial fibrillation patients from the new HAS-BLED score. We have an array of devices used by our electrophysiology colleagues to cure atrial fibrillation, to ablate it, and otherwise suppress it. We have new effective drug therapy to permanently suppress atrial fibrillation. And for the residual of patients, and it will be millions in the residual, and that number will be growing as America ages, we have a new era of anticoagulant therapy where we have made major strides in improving efficacy with fewer thrombotic strokes and markedly reducing hemorrhagic risk, especially the most feared risk of all, intracranial hemorrhage. So we can conclude that while we're in a maze, we can begin to decipher it, but we're going to come out of the other end of the maze and a light will be shining very brightly.